Hello everyone, this is Danica Ramos from RNBP Cohort 9, and my topic is about the discharge plan of a patient with bipolar disorder. The healthcare team should assist patients with hospital discharge planning, including outpatient follow-up and psychosocial education, once the patient's mood is stable enough and the diagnosis is established. In this presentation, we will be able to tackle the key components of a discharge plan for a patient with bipolar disorder, like medication management, nursing plans, support network, and crisis hotline information that can come handy. Bipolar disorder is a biochemical condition that causes an imbalance of the brain's neurotransmitters. Genetic factors and environmental pressures, such as family, work, social environments, stress, accidents, illnesses, and hormonal imbalances are thought as contributing factors. The bi in bipolar disorder refers to the duality of mood swings from feelings of great happiness and elation to sadness and despair. Mood shifts can happen over several days to weeks or even to months. A manic episode is defined as a distinct period of persistently elevated or irritable mood with increased activity or energy lasting for at least 7 consecutive days. They can also have racing speech, flight of ideas, impulsive or reckless behavior, and inappropriate spending. While patients who have a depressive episode, they will have a loss of interest in activities, feeling of worthlessness or guilt, insomnia, fatigue, anxiety, suicidal ideation, and even withdrawal from family and friends. Bipolar disorder is also one of the top 10 leading causes of disability in the world. We have 3 types of bipolar. Bipolar 1, wherein a manic episode is present and can be followed by a hypomanic and major depressive episode. For bipolar 2, there is no manic episode, but there is a one current or past hypomanic episode and a major depressive episode. For cyclothymic disorder, hypomanic symptoms does not meet the criteria for hypomanic episode, and depressive symptoms does not meet the criteria for depressive episodes in numerous periods for at least 2 years. The following are various structural change in the brain as observed by imaging studies such as PET scan, CT scan, and MRI. There is a dysfunction in the prefrontal cortex, which is responsible for executive functions such as decision-making, planning, and emotional regulations. A dysfunction for hippocampus is also present, wherein it plays a crucial role in memory, while amygdala is involved in the processing of emotions and decision-making. Norepinephrine, dopamine, and serotonin are the neurotransmitters that is affected if a patient has a bipolar disorder. Having an oversupply of these chemical messengers will cause mania, and having too low of these chemical messengers will result in depression. For patient profile, we have a patient named Jane Johnson, 28 years old, female, separated. She is a writer and believes in supernatural things. She is currently located and residing at Regina, Saskatchewan. She lives alone and was diagnosed with bipolar 1 disorder 4 months ago. There are no comorbidities, and she often goes to mall to buy non-essential things or splurging. Patient Jane Johnson also has a family history of mood disorders, wherein her maternal aunt was diagnosed with bipolar 1 disorder. Jane was previously admitted due to acute manic episode. She had 3 consecutive episodes of manic attack in the past week, hence needed for admission, and noted to have continuously yelled at her neighbor during the day before she was admitted. For therapeutic communication skills, we have here an open-ended question wherein we should encourage the verbalization of feelings and fears, like, How do you feel when you weren't able to finish eating your meal? Tell me more about it. Accept the client's statement in a non-judgmental manner when they verbalize their feelings. A non-judgmental approach may diminish the client's fear and can establish trust and rapport. Another one is remaining non-judgmental. Remain neutral, be consistent in approach, setting limits, stating expectations for appropriate behavior. Like, Jane, do not yell. If you cannot control yourself, we will help you. Or, the seclusion room will help you feel less out of control and prevent harm to yourself and others. One nursing diagnosis that can be formulated for a patient with bipolar disorder is an imbalanced nutrition, less than body requirements, related to inability to sit still long enough to eat meals. For our outcome, client will consume sufficient finger foods and between meal snacks to meet recommended daily allowances of nutrients. Nursing responsibilities: they should frequently remind the client to eat and encourage frequent high-calorie protein drinks and finger foods such as sandwiches, fruits, and protein shakes. Manic clients are easily distracted, and constant fluid and calorie replacement are needed. The client might be too active to sit still for meals, and finger foods allow eating on the run. For evaluation, Jane was able to finish her meals within the day with a lot of reminding and encouragement from the healthcare provider. For treatment outcome, for discharge, Jane is ready for discharge since she was able to finish her meals within the day and eat snacks in between with less reminder from the healthcare provider. Another nursing diagnosis is risk for injury related to extreme hyperactivity, as evidenced by maniac episodes. Our outcome should be client or Jane will experience no physical injury. For our nursing intervention, nurses should provide safety measures and supportive environment, like making sure that the client's room is free from potential hazards and that safety measures are in place, such as side bed rails up or padded walls. Clients with bipolar disorder may experience symptoms that can impair the judgment, increase impulsivity, and heighten the risk of accidents or self-harm. So, it is important to reduce potential hazards in the client's environment. In our evaluation, Jane remained free from fall, but an abrasion was noted on her right arm after her manic episode. Treatment outcome for discharge: Jane is now ready for discharge since there were no abrasions noted after assessment and there were no incidences of fall during the hospital stay. Consideration on the patient profile: since the patient is living alone, we should identify and encourage Jane to use coping behaviors. This focuses on strengths and reaffirms her ability to handle new roles Psychotropic medication: lithium carbonate. Lithium affects the flows of sodium to the nerves and muscle cells in the body. And because the onset of action is slow, it is usually combined in the early stages of treatment by atypical, antipsychotic, anticonvulsants, or anti-anxiety medications. Onset of action is typically within 10 to 21 days. Prescribers can reassure patients that these adverse effects are typically transient after starting treatment. This includes tremor, polydipsia, polyuria, nausea, and diarrhea. Lithium plasma concentrations and other safety parameters must be also regularly monitored to prevent lithium toxicity. Early lithium toxicity signs are vomiting, lethargy, tremor, and fatigue. Here are some community support resources that Jane can call, that Jane can call. First one is counseling services, wherein it provides problem assessment, general counseling, and referral for individuals with issues such as anxiety and relationship issues. It is located at Regina. We also have here the mental health and wellness services, wherein it support clients of mental health clinic and individual or family that requires mental and emotional support. And lastly, mental health information and resources, where it support the patient with mood and anxiety disorders within Saskatchewan. If ever Jane will experience a crisis, she can call or go to these intervention resources. First one is the crisis services. It is a crisis helpline when you feel or your family are about to experience a crisis situation and in need an assistance. It is 24/7, and there's also Pasca Hospital, open 24 hours, located at Regina. And that's all. Thank you for listening. Planning a patient discharge can ensure that Jane leave the hospital without incident and receive the proper care going forward. Here are my references, and that would be all. Thank you.